experts are calling for a complete overhaul in mental health treatment for children after a new study revealed a big gap in the system. There was a study that was released today in the journal Pediatrics, and it looked at records of more than 28,000 children ages 6 to 17 who visited the ER with a mental health issue. Less than a third of those kids had a follow-up visit within a week, and only half had a follow-up visit within a month. Research shows that follow-up visits reduce the risk of suicide and increase the chances the patient will take medicine prescribed to them. Pediatricians say there's been a surge of younger children needing mental health care, of course, since the pandemic. The record number of teenage girls in the U.S. now say that they've experienced violence, persistent sadness, or suicidal thoughts in recent years. Here to talk about that is Dr. Erica Lee, a psychologist at Boston Children's Hospital. It's great to see you, Doctor.
Dr. Lee, it's great to see you. That's sobering.
It is.
A record number. Violence, persistent sadness, suicidal thoughts. Forgive the simple nature of the question. We should take this seriously, right?
Absolutely. And it's important to know that this data comes from a very reputable source. So this is actually data that's coming from a survey that the CDC conducts every 2 years, where they ask a nationally representative group of high school students across the country about their risky behaviors. And so this data that came out today was actually collected in 2021, which is the first time that they administered the survey since the start of the pandemic, which makes it even more important to look at. And what it's telling us is that while there are some positives, like lower rates of risky sexual behavior, lower rates of substance use and bullying, overall mental health problems among our teenagers continue to rise at very concerning rates.
And researchers actually found some interesting things, big differences between boys and girls. What stood out to you, Doctor?
Yeah, so a few things. So overall, the study found that teen girls are generally doing a lot worse than teen boys in almost all of the areas that the researchers looked at. And actually, they found that almost 60% of the girls in the study said that they felt persistently sad or hopeless, which was double the rate of the boys and actually the highest it's been in the last 10 years. Another thing that stood out to me from the report is that over the last 4 years, they found a 20% increase in the number of teen girls who experience sexual violence. We already know from the research that girls tend to be at higher risk for things like anxiety and depression. So this is something we really need to pay attention to.
Dr. Lee, the study also includes data from teenagers who identify as lesbian, gay, bisexual, or questioning. So what should parents know about those results?
Right. So these teens reported higher rates of depression and bullying. And actually, there's some pretty sobering statistics as well in regards to suicide. So 30% of the LGBTQIA plus teens in the study said that they'd seriously considered attempting suicide. And over 20% said they actually had attempted suicide in the last year. And this is a group that already reports higher rates of sexual violence. You know, they were talking about being forced into sexual activity. I think it was more than 1 in 10 in the study said that they'd been forced into sexual activity. This is another group where we know that they're more vulnerable. They're more likely to experience depression and bullying from their peers. This is another area we really need to mobilize around.
Doctor, by now a lot of people realize that more teenagers are really struggling based on what you were just talking about. So how can parents find out if their teenager is one of them?
Right. So one of the things parents often say to me is, well, how do I know what my teenager is thinking or feeling? Because they don't want to talk to me. They don't tell me anything. And we know that teens keep things to themselves for lots of reasons. So sometimes it's just because they're teenagers. And sometimes it's because they think that their parents won't understand, or that they worry if I tell my parents what I'm really thinking about or how I'm struggling, that they're going to get upset. So I always say to parents, just start by really genuinely letting your kids know you are compassionately and unconditionally here for them. And you can just start the conversation, not necessarily by saying like, hey, have you been depressed? You know, but just asking, are you doing okay? You know, I'm always here for you if you want to talk. I'm always around. You know, I won't get mad about what you're going to say. I'm not here to criticize or judge. Or you could just say to them, I know that being a teenager is really tough. I've been reading about some of this stuff in the news. I was a teenager once and I know it's hard. And lots of teens sometimes can feel depressed or stressed. I'm here to support you if there's ever anything that I can do. Like really for parents, just letting your kids know that you're genuinely there to listen and to help can actually go a long way.
That's a great reminder, Dr. Lee. Thank you. Thank you. Great to see you.
Thanks, Doctor.
Good to see you.
Stay well.
To our viewers, by the way, if you do have mental health questions that you would like our experts like Dr. Lee, for example, to answer, just email them to ask@wcvb.com.